House Appropriations Subcommittee on Human Services will come to order. Will the clerk please take the roll?
Chair Roth.
Here.
Representative Kelly.
Here.
Representative Mueller. Representative Beeson. Representative DeSanta. Representative Edwards.
Here.
Representative Longjohn.
Here.
Mr. Chair, you have a quorum.
Thank you, Madam Clerk. And we're going to have Representative Edwards moves to approve the minutes of April 15th meeting. Being there no objections, minutes are approved. And today we're going to have a presentation on supportive housing. We have multiple guests here with us today. Thank you for all being here, and we'll try and get you up in an orderly fashion to testify before us. So, and I'm sure our other members will sneak in when we're not looking. So we'll watch for them. First up, we're going to have Catherine, Distelrath. Did I say that right? I hope. Ah, nice. Director of Corporation of Supportive Housing, along with Rebecca Binder. Yes, and also of Northwest Michigan Supportive Housing. Ladies, when you're ready, please go ahead and start your testimony.
Thank you all for having us here today. Again, I'm Catherine Distelrath with the Corporation for Supportive Housing, and we are a national nonprofit organization, so we work all over the country focused on the issue of supportive housing, but we have a team of 3 of us that all live and work in the state of Michigan. And I'm joined by Rebecca Binder, who I know is has a supportive housing organization within your district, Representative Roth. So she's going to talk very specifically about their organization and the work that they do. And so Becca will get into like a lot more detail on the types of services that are provided in supportive housing and kind of what Northwest Michigan Supportive Housing does. And I'll sort of provide kind of an overview about supportive housing more broadly. Supportive housing at its core is really affordable housing paired with supportive housing or paired with supportive services. And the services piece is so important because the target population for supportive housing is people who have been who are chronically homeless and have some type of disabling condition. So it might be a mental illness, a substance use disorder, a physical disability, et cetera. And when we talk about people who are chronically homeless, it means that they've also been homeless for a very long time, so typically a year or more. And so we're really talking about people who really need supportive services in order to be able to obtain housing and maintain their housing on a long-term basis. And it's really kind of the last stop for a lot of people is supportive housing in order for them to really be able to stabilize and thrive. And so we really see a lot of very positive outcomes with supportive housing as well. Housing stability, of course, is one of those things that that's one of the key aspects of supportive housing. Increasing income is another thing that supportive housing really helps people with. So that might be through employment. Oftentimes it's through helping people connect to benefits like SSI or SSDI and that kind of thing. Improvements in physical and mental health is another key outcome. Decreased reliance on emergency services. So we often see that when people stabilize in supportive housing, they are usually using much less emergency services like the emergency room, jail and prison, all of that kind of thing. And then, of course, decreased homelessness. So when we house people permanently, we're decreasing our homelessness in the state. So again, Becca will talk a lot more about the sort of like intensive services that are provided, but this is just sort of an overview of the types of services. So housing search and landlord negotiation, so really helping people find a unit that's going to be sufficient for them and helping sort of figure out the lease and the rent payment and all of that kind of stuff. Helping transport people to and from appointments, helping with medication management support is something that a lot of case managers in supportive housing are doing. So people might be going to a doctor, and the case managers can sort of like help people connect with a primary care physician, and then they might need support kind of like managing medications, that kind of thing. Skill building around sort of like cooking, housekeeping, sort of the example that I like to use is like, don't leave your stove on and leave the unit, that kind of thing, and sort of just maintaining the unit. And then again, kind of financial management, supporting increasing income, and then really connecting people with other services. So I mentioned a primary care physician is something that a lot of people sort of lose touch with the traditional health system when they've been homeless for a really long time. So connecting them back to a primary care physician, a dentist, the community mental health provider in the community, those sorts of things. So we, in Michigan specifically, in 2023, there were over 33,000 people who experienced homelessness, and we also see huge disparities in who's experiencing homelessness. So 46% of the homeless population in 2023 was Black or African American, despite making up only 14% of Michigan's overall population. So we are really concerned about the disparities there. And then also almost 5,000 people experience chronic homelessness. And so again, that's very long-term homeless with some type of disability. We also, I mentioned kind of like seeing decreases in emergency utilization when people are in supportive housing and receiving services. And there was a study out of Denver a few years ago that was a really rigorous study that looked at people in supportive housing over a number of years and saw a 30% decrease in jail stays and a 40% decrease in ER visits. And all of that combined made up almost a $7,000 cost offset per person. And so we really think about supportive housing as good for the person and good for the community in that way. So there has been 2 appropriations for supportive services in Michigan in recent years. In the FY23 budget, there was a $6 million appropriation, and in the FY24 supplemental budget, there was a $20 million appropriation. So we've already been able to see the great impact of the $6 million. Becca's organization is an organization that receives some of that funding, so she'll be able to talk a lot more about that impact. But so far, we've seen 470 supportive housing residents served, a 98% housing stability rate. So that means 98% of people have maintained their housing, and then 82% of people have maintained or increased their income while in the program. And then with the $20 million from the FY24 budget, we're still awaiting final notice from DHHS about the grantees for that funding, but we're estimating it to serve over 2,000 more supportive housing residents and to include some investments around capacity building for organizations as well. A key component of these appropriation requests is that as supportive housing providers are working more and more to leverage Medicaid as a revenue source for their services, the state share of the funding can decrease over time. And so that's something that is kind of built into that $20 million appropriation as well, as kind of capacity building support to help supportive housing providers be able to leverage Medicaid so that there isn't always this reliance on this funding. And so that gets me to the appropriation request. So based on the ongoing need, we're pursuing an additional $25 million appropriation for FY26. And we would expect this to serve 3,125 total supportive housing residents, so a huge impact to the state of Michigan. And then, again, the annual funding need is expected to decrease as Medicaid reimbursement increases throughout the state. And so that funding sort of goes typically to nonprofit organizations throughout the state of Michigan, which Becca is running one of those and can tell you a lot more about it.
Thank you so much. So as Catherine mentioned, we're the permanent supportive housing provider up in northern Michigan. So we're primarily located in Traverse City, but we do service Antrim, Benzie, Kalkaska, Grand Traverse, and Leelanau counties. And so our services are really primarily focused. We're a kind of single-focused organization solely on that permanent supportive housing. And so that's that combination of case management services and rental subsidies. So when we recognize the care that people are needing when moving into housing, a lot of times people always say, oh, you move somebody, that's unhoused into housing, and then they're good to go, right? We have a lot of philanthropy dollars that support the work that we currently do. And that's sort of always this assumption. I think it's really important to focus on the fact that the case management is what keeps people housed. And so when we're doing that, there is the rental subsidy piece. We recognize that affordability of one's housing is based, generally we try to base it on 30% of their income is what we deem to be affordable for their rent. But those case management services are all done in-home. So our organization is unique in that when we're doing those housing-based case management services, we are a very rural community. We are spread out over a 5-county area. And so we don't have what, typically sometimes we often see in urban communities where you have these larger apartment complexes of maybe 300 and plus units and services on site. Our case managers are scattered throughout the community. So NMSH does own and operate properties. We own 6 properties, which total 28 units, rental units. However, the majority of the work that we do are through rentals that we have with area landlords. So anything from private landlords who have, single family homes to apartment complexes or larger development and apartment complexes in the community that we're able to do what we call set aside units. So we partner with them to, set aside 1 or 2 units, let's say if they have a 100-unit apartment complex. And so our work is very different in that it's more scattered. And so our case managers are, on the road driving throughout the day, going out to reach people in communities, but also having to allow time for that. The funding sources that we receive, just sort of a brief overview, but we do have HUD, so Housing and Urban Development, is our primary funder. If you're familiar with the continuum of care housing dollars that they have, those COC dollars are what primarily support our rental subsidies for the folks that we're serving. We do have a partnership with MSHDA, so the majority of the people that enter into permanent supportive housing are going to need this service for the remainder of their life. We recognize that it is so closely tied to their mental health, their physical health and wellness, that this is, typically a ongoing service. However, there are folks that after time in housing and stabilization, they do reach a point in which they're no longer needing those services. And so we have a partnership with MSHDA called the Moving Up program. And so that's what's allowed to transition people. They still might be income limited, but they're able to transition to a housing choice voucher, but they don't need those case management services. So they transition to a voucher that opens up and creates some fluidity. I think it's important to recognize that when we have a service that is permanent, we still have to somehow be creative in keeping fluidity throughout that program and continuing to reach people. MDHHS, as Catherine mentioned, we were the recipient of the $6 million allocation, one of the pilot members, and then we've just received the Supportive Services Transformation Fund. We also, years ago, Catherine had sort of indicated the studies that were done to really target people who were experiencing homelessness, who were high utilizers of emergency department systems. And so we've been an MDHHS grant recipient for many years. I think it's also a unique thing to note that the first grant that our organization ever received was a DHHS Shelter Plus Care grant. We started as a small program within our local community mental health and stemmed out on that Shelter Plus Care grant, if you're familiar with those. And then it's also important that we have local investment. And so we've done a ton of work on the ground to educate and work with our local leaders in government to really, have their investment in this work. We see that on a federal level and a state level, we need that support, but it's also important that our own community is investing in this and leveraging in these dollars. And so the Grand Traverse County Board of Commissioners, just in November of 2024, dedicated the first ever funding to permanent supportive housing. And so we've received a 2-year allocation to expand supportive housing services. And then the City of Traverse City accepted a resolution back in December of 2024 to designate, to address ending homelessness in our community by providing permanent supportive housing. And so we're just working on the allocation requests of that. We have already started to receive some community development block grant funds to start to work on some capital improvements to ensure that we also have the capacity for this. So I want to step back a little bit and sort of talk about how exactly we get there and what these supports do. So on the visual that you'll see, homelessness creates this cycle, this terrible cycle in which people are cycling in and out of psychiatric centers, addiction treatments, jails or incarceration at some level, hospitals. Then we also, so not only is that a huge cost to our communities, but then if you also sort of look within the circle, we also have people who are providing immediate, services to folks that are unhoused. And so that's our street outreach teams, street medicine. In our community, we have a basic needs coalition. So that's anything from warm coats to sleeping bags to socks, food, water, shelter. And then and shelter itself. So you have these larger community resources that are being overutilized because people are underhoused. And then we also have our internal homeless response system that is pouring services into this, which is the least cost-effective way for communities to manage. It also it's not at the core of the solution. So just in our community alone, 53 people have died on the streets in the last 5 years. And when we look at people who are unhoused, that cost of that life expectancy, is almost half, than at about 48 on average. This is preventable. A lot of these deaths are related to living on the streets, weather-dependent health, poor health outcomes. And these are things that are, we're able to address and prevent with housing. So I'll shift to kind of talk about that model of funding. And when we talk about saying that permanent supportive housing is a cost savings to community, we decided to dive in and do a local level study of that. So when we sort of are looking at this slide, I just want to point out that today is really what we're looking at of unhoused. We took our chronically homeless, so the folks that have been experiencing long durations of homelessness, and that today is 70 folks who are chronically homeless that are unhoused. And then really looking at future is if they were in housing. So we worked, Munson Medical Center is our local hospital. And so we worked with them to really identify who these 70 utilizers are and what those cost to community. So right now we're spending about $2.4 million a year in all of those emergency department services. We had 407 incidents that police and ambulance responded to this last year, specifically in our encampment in the Pines. And then looking at those future costs of $945,000, which breaks out to about $13,000 that it costs in supportive services to support these folks, utilizing vouchers and subsidies. And then with the remainder of my time, and I might be getting close here, but I just really want to kind of dive into those supportive services. So focusing on life skills training, housing stability, budgeting, family reunification. For a lot of the folks, they've been experiencing homelessness for so long that a lot of those just basic skills, as Catherine mentioned, leaving, turning the stove off when you leave, locking your door when you leave. You don't often lock a tent. You don't often, have things to be able to walk away from. So these very simple things that I think we often take for granted, but when people are living in this cycle for so long, it's really important that we start to sort of ingrain these back into their daily living. Budgeting, right? Having that access to income, to financials, is that first step that we see in people really regaining that independence. For our family reunification, we have a lot of folks that come into our program, and they are families with children, but those children might be in the foster care system or living with other family members or friends while the parents are experiencing homelessness. So it's really important for us to make sure that those children are stabilized, attending school, really kind of looking at the family unit as a whole. Any opportunities to prevent that generational cycle is so important for us. And then really just that reintegration, access to healthcare, mental health, income. I think, reintegration in community, that's connecting with faith-based groups, senior centers, whether that's, for a lot of our folks, it might be, Alcohol Anonymous or Narcotics Anonymous groups, sobriety focused, or otherwise. I think it's really important that we're creating these situations. Everybody needs this support system. And so how do we sort of create those for our folks? And then just the last 2 points to really touch on is just that 57% of the people in our program did gain or increase income from the last year, and 96% retain. We had that retention rate. I just want to emphasize that prior to us receiving the MDHHS funds for supportive services, our retention rate was closer to 92%. So these funds specifically keep people in housing. We have seen that as we have these funds and as we're able to, to provide these services at the rate and the level that are needed, we're seeing those retention rates. And so that means that we're seeing, a reduction in recidivism and returns to homelessness, which is what we want and better for communities at large. So thank you for your time.
Thank you. Appreciate it. I think we'll take questions at the end. Let everybody come up and talk first, but thank you, ladies. Appreciate it. Thank you. Next up, Ashley Halliday Schmatt. I hope I said that right. Is Ashley here?
I'm on Zoom.
Oh, geez, you're on Zoom. Sorry. They didn't tell me that one. Welcome. When you're ready, we will get your picture up on the screen and hopefully. And
Can you hear me okay?
yeah, we can hear you fine. Go ahead when you're ready,
Okay,
please.
great. Thank you. Thanks, Chairman Roth and members of the committee. Thank you for this opportunity to speak today. My name is Ashley Halliday Schmant, and I serve as the director of the Northwest Michigan Coalition to End Homelessness. Like Becca from NMSH, we also serve the 5 rural counties in Northwest Michigan of Grand Traverse, Antrim, Benzie, Leelanau, and Kalkaska. And the coalition's role is to coordinate the housing, the funding, and the services for people experiencing homelessness. So I'm here today in strong support of continued and expanded investment in the Michigan Supportive Services Transformation Fund. This fund is a lifeline, not just for those we serve, but for the stability of our communities and the sustainability of housing systems locally that prevent and actually end homelessness. I want to first thank you for your prior support. Northwest Michigan Supportive Housing, as Becca mentioned, who is a core partner in our region, was awarded SSTF funds across the previous 2 years, and that built on almost $700,000 ask in the original pilot phase from MDHHS's $6 million allocation. These funds have had an enormous impact in our community. More specifically in Grand Traverse County and in Traverse City proper. They allowed NMSH to provide services at the recommended 15-to-1 client to case manager ratio, which is the evidence-based level of care that helps people stabilize in housing and reduce recidivism back into homelessness. And I believe Becca even mentioned some statistics around their program-specific recidivism rates getting better after they received this funding and were able to appropriately allocate case managers to clients. They also supported, or these funds also supported the expansion of supportive services to additional residents through Grand Traverse County when we asked for a local appropriation for permanent supportive housing. We were able to leverage local investment alongside these state and federal dollars. Because of these investments, at least 10 additional households will be served over the next year, thanks to the combination of SSTF funds and increased rental assistance. 10 households moving into housing and off the streets in our region will have a huge impact. Right now, there are around 250 people experiencing homelessness in our region, and of those, and I believe Becca mentioned, right around 20 to 30% of them need supportive housing. Supportive housing, when fully resourced, works. It just simply works. It saves lives and it saves money. A 5-year randomized control study shared with us by our partners from the Corporation of Supportive Housing showed when folks are fully supported in their housing, there were 40% fewer arrests, 30% fewer days in jail, 40% fewer emergency room visits, and a 155% increase in primary care visits. So that shows when folks are actually housed and supported and off the streets, they're able to meet their needs to actually better their lives. That translates to almost a $7,000 per person annual cost offset. And these are the kinds of outcomes that matter to our local governments and the things that we share with our healthcare systems, our local units of government, and our local taxpayers. The Northwest Michigan Coalition to End Homelessness has also spent time studying the cost of homelessness, and as Becca mentioned, the cycle of instability that leads to early death for those without housing. The average life expectancy of someone who is unhoused is just, as Becca said, about 48 to 50 years old, so nearly 30 years shorter than the general population. In our own region last year, we lost several people to the streets who should still be alive today, and we cannot let that continue. I wanted to also lift up the local investment we're seeing in Northwest Michigan because it's extraordinary. Our county has allocated $125,000 per year for 2 years towards supportive housing, which is a first for our region. The city of Traverse City has also signed on to plan to end chronic homelessness through the expansion of permanent supportive housing and has also allocated just shy of $360,000. These are not just symbolic gestures, they are budgeted commitments that align local resources with this state level funding. And finally, I'd like to close with a story. Many years ago, I had the privilege of working as a case manager, actually alongside Becca, helping folks experiencing homelessness become housed and stay housed with supportive services. One of our clients had been homeless for over 10 years and had been arrested over 100 times for homelessness related issues. We found a private landlord who would work with our program, and then were able to secure additional funding through a source very similar to SSTF before that was a thing, to provide him with rental subsidy and supports long term. This client remains housed to this day and has spent over a decade in housing. So that's really what supportive services can make possible. Chair and members, the SSTF fund allows us to meet people where they are and keep them housed. But we can't afford to pause or pull back now. The timing is right in our community, and we've really set the stage for greater investment. We're grateful for the $20 million investment in the FY25 budget, and we urge you to support a $25 million appropriation in FY26 and beyond. Supportive housing is the solution to homelessness, and SSTF helps us get there. Thank you for your time, your leadership, and your commitment to ending homelessness.
Thank you, Ashley. Appreciate your testimony. Next up, we'll have Kent Wood and Yarrow Brown. I know this, I should know this by heart, but it's Housing North. Geez, simple. Hi, guys. Welcome, and please test your testimony.
Good morning. Thank you, Chairman Roth and members of the committee. My name is Kent Wood. I'm with a consulting firm called Borealis Strategic, and through that serve as a policy advisor for Housing North. I have with me today Yarrow Brown, the executive director at Housing North. And we wanted to take a few minutes today to, pull back a little bit, talk about the bigger picture when it comes to the housing ecosystem, especially housing development, and why it can be so challenging if we have issues of people that are not housed. I know you all know the great housing challenges that are impacting your districts. And so, we know that as you work through these issues of human services, homeless services, you may often be faced with, or your colleagues or people in your communities, we have a great need for housing. We have developers to do that. Why can we not build more housing? And so we want to chat with you a little bit today just about some of those challenges, certainly the challenges that we see Housing North sees up in northern Michigan, and what Housing North is doing to address some of those challenges and remain nimble in today's marketplace. So with that, I'm going to turn it over to Yarrow Brown, the executive director of Housing North.
Thank you. Can you hear me okay? Is this working?
All right. So thanks for having me. You can see our mission and vision on the screen here. We are a 10-county nonprofit, so you just heard from folks that cover 5 counties within our 10-county region. And we were formed in 2019, and we focus on 3 core areas. So communications and awareness, policy and advocacy, and capacity and resource building all around housing. This slide here, I just wanted to point out, housing is an inelastic good. As prices go up, people cannot choose to buy less housing. Housing is a necessity that we can't go without. And we have a housing crisis in Northwest Michigan, and a lot of this has to do with supply and demand. We have simply not been building enough housing for decades, and we are a desirable place to live with extremely high prices for housing. Just want to set some context for where Northwest Michigan is, if you all haven't been there. And you can see that, we have a population of about 300,000 people spread out over 10 counties. We cover 187 units of government, and while we are making some huge strides in housing, we do have a long way to go. Our program through Housing North, our Housing Ready program, puts boots on the ground to help in each of these 10 counties to meet their housing needs. And what guides our work is a housing needs assessment. So this is a dashboard on our website. We need about 31,000 homes in our 10-county region between now and 2027. We are tracking zoning changes as well as progress towards that housing, and we can tell that we have almost 4,000 units that have been built, so about 11% of our goal, and we still have a ways to go. So I want to talk just a little bit about the barriers, and I'll put up a few slides here, but we're really dealing with not only cost gaps, we're dealing with zoning barriers. We also have very rural communities with limited staff and capacity. We're also not eligible, or until recently haven't really been eligible for a lot of the programs in our rural communities to get the housing, and we're also facing a lot of community opposition. We make some progress. We had a lot of progress made in one community for zoning reform, and then that happened to be repealed. So we do really need to work on this community opposition and get aligned with our community members and our partners. So it's really expensive to build housing. That shouldn't be too surprising to many of you. And I would say that even this number of $375 a square foot is going up. In order to be able to afford the minimum cost without subsidies of an apartment, you would need to make at least $55,000 a year, and at least $75 to purchase a home at about $278,000. And in this case, that the mortgage does include taxes, and these are without subsidy right now. We also know that depending on your income level and opportunities, if you're making $50,000 a year or less, you are going to need some subsidy to help bring that housing. It is just simply expensive. And in our region, over 50% of the need is for those making $50,000 a year or less. When you get into higher wage earners, you can, with flexible zoning and some of the new housing tools, you can build this type of housing. And a lot of our work it's focused across this income spectrum, but is to help make things more flexible in our region to build the type of housing and the density that we need. So we need to be nimble, and we need to think on our feet and also be patient. We're working at Housing North on a lot of regional tools. We're partnering with different partners like community land trusts. We're advocating for policy changes, which were passed in 2022, and really getting those into the hands of our communities right now and how to use them, and really focused on zoning reform to be able to help our communities access these tools and really see that predominantly we're single-family zoned, and in order to meet our housing needs, we're really going to need to change that. So we're working on a few things at Housing North I just wanted to mention, and one of those is to create a revolving loan fund that would be for our region and help create low-interest revolving loans to help offset the huge gaps in our housing needs. You'll get a copy of these slides, so I won't go into this in much detail, but we're really focusing on projects that would support those making 120% of the AMI or less, and it would be nimble and be able to be a resource that's available every year for our community. We've also developed a toolkit. There's a lot of words on the slide, but there's about 12 different tools that we're bringing into our communities and helping them understand how these tools work together or separate, and policies and ordinances and ways they can bring these tools to our community, because without a lot of these tools, we simply won't see the housing built that we need. We have new handouts explaining a lot of these tools. There's a lot of acronyms in housing, so PILOT, payment in lieu of taxes, or housing tax incremental financing. We have a heavy lift in our community for many to use these tools, but we're really hopeful that our communities will use them. And then the zoning reform toolkit is really an important resource. We're encouraging all of our communities to align their comprehensive plans or master plans with zoning reform using this toolkit, and one of our communities has already done that, which is really exciting. And so I'll just, I guess, close and see what else he has to say, but we really do need diverse housing solutions for our rural communities. We also need partnership of the state, our local units of government in together, and we urge you to support flexible and smart investments in housing, including direct appropriations for gap financing and capacity building. Ken, anything to add before I?
Just one thing I will add before we close, and that is just to to remember also that I think probably in most of your areas, I know certainly in our whole region, Rep Roth, the need is not in one particular income bracket. The need is everywhere from the lowest of the low to your McMansions, let's call them, market rate and well above market rate as well. And so, that's part of the challenge too. Is there's need throughout that spectrum, and so certainly there's a great opportunity to build and successfully homes and in units that are market value and well above market value, and so, hopefully it's obvious that is part of the challenge as folks with much greater income that can afford those. If those types of homes and units aren't on the marketplace, then they will start dipping into houses and units that are lower income, lower down that chain. And so again, just as a reminder that the need is great. It's in all of those income levels, and as we start working into, especially on issues of human services, homelessness. Just remember that this exacerbates that situation because there aren't enough homes. Certainly, I know in our region, I think a lot of regions around the state, there aren't enough homes to meet demand at all price points right now. Thank you.
Thank you, guys. I appreciate it. We'll call you back up in a few minutes. We're going to
Thank you.
bring up Dwayne Haywood, Senior Director, Deputy Director of Economic Stability Administration of DHHS. Thank you, Dwayne. We got about 10 minutes, and we want to bring everybody back up.
We'll start over. Okay, good afternoon, everyone, and thank you, Mr. Chairman, and thank you to committee for allowing me this opportunity. Again, my name is Dwayne Haywood. I'm the Senior Deputy Director for the Economic Stability Administration within the Department of Health and Human Services, working with the Housing and Homeless Service Division. So today I'm just going to go give an overview of the homeless situation in Michigan, and then I'm going to talk a little bit about the programs that we administer. In 2024, we had a number of over 31,000 individuals who were homeless. And as you can see on the chart, nationally, it was 18% in 23, 18% increase in the number of homelessness. For Michigan, during that same year, it was a 6% decrease. So as you can see, there's work to be done, but certainly we need to continue working that way. And you can see the breakdown. Veterans, 6%, near and dear to my heart because I am a veteran, so I'm always looking at that piece. The youth, 9%. Seniors, 55 and older, 16%. Multiple time experiencing homeless, 19%. Families, 33%. And then first time experiencing homelessness, 48%. So again, pretty good numbers, pretty diverse. And again, I wanted to talk to you about the many partners who are here and also our state partners. It is a network of collection that have to deal with the homeless situation. And so, as you can see, the MISTA, the Michigan Department of Correction, the Veteran Affairs, Department of Education, Department of Natural Resources, the Department of Transportation, the State Budget Office, and the Michigan Coalition Against Homelessness. Again, a network of partners to work on homeless issues. So let me go and just talk a little bit about MDHHS, the impact that we have. MDHS grants more than $60 million in federal and state grants. 71% is federal, 29% is our general fund, and this goes to the nonprofit direct services across Michigan. What that entails, I'll just give you a little snapshot. Providing more than 1 million nights of emergency shelters and moteling for unhoused adults, families, and youth. Providing rental assistance for more than 2,700 people who previously were homeless. Providing supportive services for more than 1,000 people in permanent supportive housing so they can remain housed. Enrolling 800 unsheltered individuals with mental health, substance abuse, physical disabilities in programs and services to get them housed and safe. And then connecting another over 1,400 unsheltered individuals to housing services. Some of the long-term programs, emergency shelter programs, issuing these funds across the state to various organizations, i.e. Salvation Army may come to mind. Our PATH program, teams that go out and work with the unsheltered individuals and homelessness to connect them with the services, i.e. some challenges, physical challenges present itself. Our rapid rehousing, 18 to 24 months of rental assistance to ensure that meaning the homeless remain in their homes. And again, with this rapid rehousing, you have minimum case management, and we'll talk a little bit about that case management. Next, you have the supportive housing, which is the most expensive, least available, but that's long-term financial assistance to try to make sure that the homeless maintain their homes. And then the homeless youth and runaway programs, those providing that shelter, transitional housing for those who are runaways. And then we have the housing opportunities for persons with AIDS, and that is those who test positive for AIDS, assisting with that financial assistance. And then SOAR, connecting our individuals with the services, the Social Security Administration, to help and maintain the homeless in their homes. And then I just want to go over some new investments. Our new investments we're really proud of is the Emergency Housing Fund. And this is a fund that actually addresses families who may have some involvement with the child welfare families. And then we have the supportive housing pilot, which you heard a little bit about, which is so important, i.e. A lot of the funds that we talk about is the kind of the brick and mortar, but these funds really help with the case management. Remember, I think one of the young ladies said case management is important. And so if you marry the case management with the homeless, the shelters, you get to a better position. And then our master leasing program, and that's working with our landlords to secure apartments and housing. And as I close, we talk a little bit about the challenges of certainly providers, the impact, turnover. We heard a little bit about turnover, low wages. And low wages really cause the insufficient staffing, so it's a cycle. And then the insufficient housing, we heard a little bit today about insufficient housing, the need to build. We certainly have that as a challenge. And then the increased cost for shelter and rent. We're seeing that our shelters have increased by 9 days. And then the lack of affordable housing, longer shelter stays, which limit the number of people who we can serve. And with that, I will end my
Thank you, sir.
presentation.
Wayne, we appreciate that very much. Can we have everybody come back up? Rebecca,
I didn't have
Kent,
to move.
yeah, you can stay right there, sir,
Okay.
if you want. I'm sure we can fit everybody in. Did we lose Catherine? Yeah, we lost Catherine. No worries. So, yep. And I know Vice Chair Kelly had a question. We'll let him lead off if you want, sir.
Well, just some of the, I'm sorry, one of the pages you had outcomes, and I was, that from prior investments, and I was just wondering what those what timeline these outcomes are based on. Is this 1 year? Is it 2 years? Is it 6 months? A month? I mean, what was some of the?
Yeah, that. Thank you very much. It specifically related to some of the outcomes that occurred with the retention rates and the income increases, if specific to NMSH. Those often, when we're talking about those outcomes, we're looking at the last full fiscal year that occurred. So specifically for NMSH, those increase in income that we saw, the improvements in our retention rates, those were for fiscal year 2024. So that's a January 1 to December 31. However, I know that Catherine had also talked about some outcomes that they experienced through some of those pilot programs. And I'd be happy to pass that message on to her, and she can follow up specifically with what dates those were on for her portion of the program.
Vice Chair Edwards.
Thank you. Sorry. In the first presentation, someone mentioned that it was 57 to 82% individuals maintain or gained or increased their income. But, I mean, that sounds like a win, but I'm wondering, are there any bigger wins in this capacity?
In relation to income specifically, or just programs as a whole? Absolutely. I could go on for a long time about all the wins, but respectful to time, we always try to sort of just pull a few. I mean, I think when we're really, and I don't have the data in front of me at the moment, happy to provide it, but when we're looking at what some of those other wins are, we are seeing those immediate reductions in people utilizing our emergency departments. So folks that are, utilizing them at high rates, once they're in housing, we see those go down. We have a really close connection with our local police department and sheriff's department. They immediately see fewer, some of those reoffenders that they've, and reoffending mean folks that they have seen frequently, on the streets. We immediately see a reduction in that. They often know that those folks are housed. We stay connected. We let them know who's moved into housing. And so they're really encouraging and supportive. Instead of saying, hey, let's, pick up, go to jail, they'll work to say, let's get you home tomorrow, work with your case manager to go address that, those fines or outstanding fees, or, if there's something going on that they might otherwise pick up for historically, they'll redirect to home, redirect to case management, and avoid that jail bed stay. Connection to mental health and then physical health. I mean, the improvement that we see in people's connection to physical and mental health when they move into housing is probably the greatest outcome that we see. Immediate, improvements, anything from a lot of those homelessness related illnesses that happen, but then also just that stabilization. It's not all med management forced, but people finding whatever that recovery journey is for them. And for NMSH specifically, and for a lot of the folks who are experiencing homelessness, when they're on the streets, they are, unmedicated, untreated, severe, persistent mental illness, which is at the root of what so many of the behaviors that we see that exacerbate the stigmas of homelessness are. And so once in housing, we really start to work and address that specifically.
Representative Longjohn.
Thank you, Chair. And thank you for all the presenters and the presentations. Especially thanks to Chair Roth for organizing it this way. I think the way that you have all been able to provide different kind of views of the elephant here is a great case study in how we need to think about this. You made it clear that this housing thing really belongs in the HHS conversation, and again, you did a great job. I wanted to unpack a little bit here. It's not just the last thread that you left us on, thinking about stigma and homelessness and mental health issues, but people with diabetes, right? If you don't have a home, if you don't have a refrigerator, you can't take care of that insulin. There's so many ways that what you've just painted, where housing leads to healthcare costs, is important to lift up. I also wanted to pick up, I'm so sorry, I don't know your name off the top. Becca, when you were presenting, you talked about the importance of navigational services in particular, the case management part. And I have a couple questions for you. One is, are you at all aware of the Accountable Health Communities projects that have shown that while there's massive savings when you actually get people housing, that just providing that case management shows savings to Medicaid, that you don't necessarily have to go all the way to getting people into stable housing to already see savings. Is that a model you're building on when you talk about the importance of case management?
So we're part of having the 6 million pilot was that we also received technical assistance and support from Corporation for Supportive Housing to look into that. So we're not that pilot is still doesn't end until September 30th of this year. We are looking at what those costs. So we've a few things that we've done so far. I don't have the data and the answer today for you, but happy to share it when we have it. We've started to do time studies within the organization. So we did time studies prior to these allocations and then doing time studies post. What that allows us to do is to address all of the services and identify all the services that are being provided, identify which ones of those are Medicaid billable, if any of those are the pre-tenancy services or post-tenancy services, so meaning that build up into housing before they actually, prior to actually moving into housing, but any of those that are happening before. So we're still in the research and investigation stage of that, but we've got all of that laid out to really be able to identify, give us as I showed earlier, those cost savings. We looked at it from a larger level of our hospital and our police and law enforcement and health responders, but now we're really trying to get kind of down to that specific number for the case management services.
But am I wrong to guess that the recipients of these services are 95% of them are Medicaid enrolled?
Absolutely, 100% of the people in NMSHs.
I didn't want to exaggerate.
No. Yep, absolutely, and we may also, some also have Medicare or other coverage, but 100% are Medicaid enrolled.
Sure, and I guess the reason I asked a question about whether you're basing your pilot on that kind of work is, we can pilot ourselves to death, right? The Accountable Health Communities demonstration project that was run by the National Medicaid Office involved over 1 million people with housing issues, and we know those savings are there. My last question is for Director Haywood, and if we can't figure it out now, would love a follow-up.
Okay.
I know in the last contracting period, all of us on this side of the table were in an Appropriations Committee meeting last week talking about the costs of Medicaid increasing. So I'm wondering, as the department is, as a whole, is learning lessons from the housing pilot, et cetera, what are the thoughts about expanding things like how in lieu of services or 1115 waivers could get housing supports covered with claims under Medicaid, not asking them to come back every year for an appropriations ask, but actually embedding housing supports into the business of Medicare. Is that anything you could speak to?
To be honest with you, I can't speak to it specifically, but I will take the information back and I can provide a thorough answer for you.
Thank you, sir. Those are my questions. Thank you, Chair.
Thank you. Good questions. What happens if you, Rebecca, run into somebody that does have some income? So one of our more prominent homeless in Traverse City, I know he actually had money coming in, but he still, eventually he moved to housing, but he resisted that for a long time. But how do you handle that when somebody has obviously not enough income, but let's say $700-800 a month that are coming in but can't afford housing? How do you guys deal with that?
Yeah, so anyone coming into the program with any income right off the bat from that first month, they're paying 30% of their income towards rent. However, we receive those subsidies. So going back to the HUD funding that we receive, those are what's providing those subsidies. So on average right now in the Traverse City community, we're seeing one bedrooms average somewhere between $1,200 and $1,500 a month. We can't exceed just over $1,000 in what those HUD fair market rents are. So it is a challenge, as Yarrow and Kent spoke to, the challenge of housing specifically in many communities, but I'll speak to ours specifically, is really tough. That said, when we do have that, that's where that subsidy immediately hits. If somebody doesn't have income moving into housing, that's a high priority, right? Not only so that they can start to make those rent payments, those subsidies are, they are able to cover the entire subsidy while somebody's without income, but we also know that that first step to independence is people accessing income, and so we really start to target and identify that. And I wanted to speak to, you mentioned, somebody who's resistant of housing for a really long time, and we do experience that, and we hear people saying that all the time. I think it's really important for us to remember as well that when we are looking at the folks that we are starting to work with when they're still on the streets and still unhoused, we haven't exactly created a society that is welcoming of people coming forward and saying, I'm really ill, I'm very unwell, I have a lot of challenges, can you please help me? So I've been fortunate to work in this work for about 15 years, and I think it's so important to remember that when we hear, I have never actually truly met somebody that doesn't want housing, but I have met tons of people that say they don't want housing because they don't believe that they have what it takes to live in that housing. And so I think these support services allow us to have those conversations. Ashley spoke about the person that is living 10 years now. They've renewed a lease year after year. I think those are the really important things for us to remember, and this funding allows us that opportunity.
A little bit of a follow-up on that.
Yeah.
Is there maybe the department has something to, any average of how many years of supportive services are required of some of these individuals? Is it 3 years? I mean, I don't even know if you can give me an average per se, but is there something you guys see that you can give us?
Yeah. I don't have that data in front of me, but we do have that. We have an easy way to access that, and I'd love to share it. I think that's a great question. It's so varying. We have some people who we have experience in the past where people move into our program 2 years. Others, 10, 15 years. We also have people who have moved in that we don't think will ever move off the program, and we have been so pleasantly surprised by the growth that they've, been able to accomplish. All set.
And we will actually take the question back also.
Yep.
Thank you. I do have a question for the Housing North. Maybe, Yarrow, you could give us some of the ideas of what kind of community resistance are you guys seeing? I mean, zoning. What are some of the things you do see? Give us a few ideas.
I would say zoning is the number one, and a lot of the people showing up, often in opposition are not the ones, experiencing the housing crisis. So I think we are predominantly zoned single family, and we are just finishing the second pilot of a zoning atlas project. So you can see Grand Traverse County now is digitized and the ordinances are zoned, and if you go on there and click, where could I build something over 4 units, all of a sudden the purple goes away and it's all pretty much white. So, we're really in a situation, if we're gonna meet our housing needs, we need to figure out how to increase that density. And I think that's one of the number one barriers when you're in a region that is a vacation spot. People move there to get away. They don't want to see change. But in our case, change is inevitable and people are coming and moving to our region. We can't just, say don't come. And I would also just say that there's a huge gap in vouchers in our region too, and a lot of that is because there simply aren't enough units. But in our recent housing study, we had 8,500 people are without vouchers in our region or would use them if we had the housing for them. So that's a pretty stark number. I'll also just say I think we have to change hearts and minds, and it is a cultural thing. There are people who don't really, I think, understand or want to see that there are people that are living in poverty in our region, and it's uncomfortable to talk about it. But we do have really high ALICE percentages. And so I think there's a lot of that. A lot of our work is sort of presenting on refresh and reminding and going back in and working with the communities who really want us to be there first, and then I guess pushing our agenda more in some of the other communities. But there are 37 zoning changes that have happened. So I think that's still a huge win.
Right.
Yeah.
Representative Edwards.
I'm sorry. Thank you. I just had a follow-up question for the department. I asked the young lady next to you what the wins were, but what does the department see as the wins?
Oh, we have a couple wins. The 6% that you heard about, when nationally it was 18%. So we know it's still a lot of work to be done. The pilot for the child welfare, engaging families with the financial assistance to really make sure we prevent that family from going into any type of child welfare. Since the inception of that pilot, we've helped about 426 families. So those are two really important wins. We think this is great, and we're going to build on it.
Thanks.
Representative Kelly.
Thank you, Mr. Chair. First of all, I suspect it's a good sign from looking at the Northwest Michigan supportive housing. If in 23 you spend $6 million for 470, so that's 13,000 per person. In 24 you spend 20 million on 2,000 or more, that you get it down to 10,000 per person. And you're hoping to get to 25 million in 26 to serve 31. You get it down to $8,000 per person. So I suspect that's a good measure. The costs are coming down for this. But at the same time, I'd also like to see some sort of cross profile of a HHS recipient of some sort, where there's SSI, TANF, SNAP, homeless, Medicaid. This adds up to real money. My guess into $50,000, $60,000, $70,000 a year. I'd like to see, and I suspect there's people on multiple rolls of these programs. And at what point do we, 70 grand, that's a pretty good job. That's what I'm paid. At what point do you cap out of benefits that this country has given you without putting anything back? This may sound harsh, but we spent trillions and trillions of dollars since the 60s on the war on poverty, and don't seem to ever get a hold on this. We seem to grow poverty, not eliminate poverty. So I think there's something kind of screwed up in a lot of this. That I'm looked on as somebody heartless to point this out, I suspect. But this is unsustainable. You just can't keep giving more and more people more and more things without getting something in return. Leave it at that.
I'll just mention one thing. I think I can speak to the work that we do at NMSH. We work really closely with our Department of Health and Human Services, which those TANF funds are coming out of, SNAP funds are coming out of. Every single year, anybody who's in our program is also connecting. There is a DHHS worker, before they renew those benefits, that worker reaches out to our organization to say, okay, I see that they're receiving these services and they're also getting a rental subsidy for you, right? They're saying they live in housing, so there's got to be the paper trail for the rent payment. They're living in housing, you're paying that subsidy, yes. What's the progress towards income? We do have locally on the ground, at least in our community, we have that communication open. And we have had situations in the past where it's gotten to a point where we've said there's not progress working towards, they're not making progress towards Social Security benefits or employment, whichever route, is most appropriate. And the department will say, then we're going to, evaluate termination of benefits. So I would just say that we do have those open communications. We are, it is important for us to be good stewards of our funds. I think you bring up a valid point of of assessing all the angles. And so I think it's important to be good stewards. And that's something that I know that at least within our community at NMSH we do. And it's important for us to do that and to work with folks in these ways. So I just wanted to add that.
Seeing no more questions, there's no further business. The meeting is adjourned. Thank you.